At our Deloitte Health Connect event in February, Dana Lewis shared her story of persistence, ingenuity, and innovation. She spoke about the artificial pancreas system she designed to manage her insulin dosing to treat her type 1 diabetes. Now she joins us again. She's sharing her personal views about what it means to be in a high risk group for COVID 19 and living with the fear, anxiety, but also hope until we find a vaccine.
Hi everyone, I'm Dana Lewis, and I'm an individual living with type 1 diabetes in the greater Seattle, Washington area in the United States. I first learned about COVID-19 in early January. I started seeing the reports on Twitter of the data about the virus in China, and I was pretty concerned. I'm a numbers person, so I could see the exponential growth curves and understand how infectious this was, and I was predicting that it was going to spread worldwide. And unfortunately, that's what happened. I actually live here in the greater Seattle area, where towards the end of February, we had the first death that really alerted us to the magnitude of how COVID-19 was affecting our community. Great analysis done by Trevor Bedford and others showed that COVID-19 had been spreading undetected for about 6 weeks. So we had a real problem here. About a week before that death was announced, I had decided to social distance myself. That meant staying at home and working from home, which actually wasn't a change for me, but it also meant not going out to eat at restaurants. It meant not going to see family and friends, not going to the grocery store. And my husband also began working from home. And I recognize that I'm privileged enough where this wasn't a big shift for me, and my job did allow me to work remotely and work from home to help mitigate my risk of getting COVID-19. I'm concerned for myself because I live with type 1 diabetes, but I'm also concerned for my community. And I wanted to make sure on the off chance that I did get COVID-19, that I wouldn't be one of the people who inadvertently, without knowing it, spread it to somebody else. Living with type 1 diabetes, whenever there is a disease, whether it's COVID-19 or flu, you hear a lot about being told that you're a vulnerable or high-risk population. And especially with something new like COVID-19, it can be really scary because you don't know anything about what that disease is or how it might affect you or how your risk might be different. And in fact, the early data coming out of China showed that about 7% of people who were dying with COVID-19 happened to have diabetes. And it was unclear if that was type 1 diabetes or type 2 diabetes. It wasn't clear how that was affected by age. That data wasn't separated. So we had age group data showing the risk of death from COVID-19. We had comorbidity data showing those who died and if they had another chronic illness or not, but we really didn't have anything that allowed us to triangulate those two sources of data, which meant people with diabetes and other chronic diseases felt really afraid. And it wasn't until I saw a preprint with data from about 1,500 people that showed an idea of around using a hazard ratio to calculate the risk from 1 or 2 chronic illnesses in general, and for specifically having a chronic disease hazard ratio for a particular type of disease like diabetes. In my case, it's about an average 1.59 risk compared to my age group of a combined risk of going to be hospitalized, being ventilated, or dying if I were to get COVID-19. Now, my age group is that of a 30 to 40-year-old. And so the death risk is about 0.3% based on the early China data. So you could take that number, 1.59, multiply it times 0.3, and see that my overall risk of hospitalization, ventilation, or death by triangulating those numbers isn't that much higher compared to my age group, although it is slightly higher. So that made me feel a little bit better about my personal impact of getting COVID-19 were I to get it, but it also helped me recognize how important it was to protect people in different age groups and those with 2 or more chronic illnesses, because the hazard ratio of a severe complication of COVID-19 is so much higher for those individuals. And I think it's really important when we talk about COVID-19, even if you're not concerned for you, there's likely somebody in your family who is older than you and at higher risk of a severe complication and a severe outcome, or there's somebody with a chronic disease that you don't even know about that puts them at higher risk. And so it's important for us as members of our communities to not only protect ourselves from getting it, but also to stay at home and protect ourselves from giving it to somebody else as well. So we've made progress. We are seeing in many places we're able to flatten the curve thanks to early efforts to stay at home and social distance and keep our healthcare systems from being overwhelmed. But sadly, many people in our communities have passed away, and it is possible that we could have a second wave. So as we look at ending these social distancing and stay-at-home orders, we have to be thoughtful and have tools to allow us to earlier choose to self-isolate if we have symptoms and prevent the spread of things like COVID-19. But that also means we can cut down on the spread of things like cold and flu. It's really important that we do that for people like me, as well as for your loved ones who also have chronic diseases, and also by protecting everybody around us, regardless of their age. So for those of you who have taken early action or are taking action now to stay at home, maybe you're working from home, going out less if possible, thank you. It helps protect people like me, and it also helps protect your loved one as well.